The key points were that we have a long way to go to actually address service delivery issues, and which are necessary to get to high-value health care. The law definitely made enormous strides on trying to get coverage available to people. I think that in and of itself will improve the value of the healthcare system as people get into and can stay in a healthcare program. But the need for service delivery changes that change the payment system and the information for patients as well as providers is vital. I think a lot could be done in the arena of improved safety and quality improvements. I don't think that this is rocket science, that we ought to not have 100,000 people a year dying of hospital-acquired infections, a couple of million more who are damaged, injured from that because they went into a hospital. Those are types of things that are treatable. These are changes that can be easily accomplished and would not only be better quality care, it would be better savings in terms of unnecessary expenditure, and people's health care would be better. I think the most important thing is to have an informed consumer, which is easy to say and incredibly difficult to do. To have a healthcare system that can really serve the needs of consumers, they have to be a partner. And many people have, because of the way the system has been set up, just expected to be taken care of and not really owned responsibility. Certainly, my mother's generation would never even ask a question. Today, we have people who not only ask questions, but they get on the internet and they search for information before they go in. That is one tiny example of the kind of changes that could make an extraordinarily important difference. You cannot impose a high-value healthcare system on consumers or patients who don't understand what that means and don't own their responsibility in that system. So in terms of using some of the enormous breakthroughs in information sharing that we have through the internet and other similar already in place sources of information, we need to reward patients for owning their healthcare situation and actually making better choices. We've got a long way to go in terms of having systems that give them all the types of information, reliable, trustworthy information that they can use to do even better. But there are things that can be done quickly and right now that I hope that we'll see happen. I think these kinds of symposiums are extremely helpful to let people get together and hear what different sectors are doing around some of the same issues. The panel we were on today, I was the only consumer or patient representative, but we had the people who train the doctors, we had the representative of the physician community, the head of the health plan community, and a representative of an important business group. Those are all the key elements, and it was extremely valuable, I think, for people to be able to hear what each other are doing, try to find common ground where we can either leave this symposium and actually work together to accomplish some things.